Hi, I'm here to tell you about pediatric brain tumors. This is an important aspect of caring for children that has changed tremendously over the last 2 or 3 decades. Pediatric tumors generally afflict patients, and when we talk about that, it's between the ages of birth till about 18 or 19 years of age. Now, in this age group, you could have an incidence of approximately 5 per 100,000 patients affected by a brain tumor. The brain tumor has no significant change between males and females, and it depending upon the location and the age, presentation and symptoms and signs vary. So, younger children, it can be very difficult to pick up the symptoms of a brain tumor, but when examined closely and when changes in behavior, feeding pattern, sleeping pattern, things like this are observed carefully, they could sometimes reflect the possibility of a brain tumor, which emphasizes the need to be seen by properly trained pediatric neurologists or neurosurgeons in this field. As children grow older, they could have symptoms like vomiting, complain of headache, walking difficulty, there could be seizures, speaking difficulty, among other symptoms which could manifest as a brain tumor. The older children get, the easier it could be to diagnose brain tumors. But having said that, it is absolutely necessary that you maintain a high threshold to diagnose brain tumors. Now, brain tumor treatment has evolved tremendously, and today we have a situation where over 75% of children with brain tumors have 5-year survival. As a matter of fact, these sort of tumors are actually the most common solid tumors that are seen in children. Brain tumors are the most common solid tumors seen in children. So, considering that common and that we have achieved survival of over 75%, 5-year survival, including all malignant as well, it's a tremendous progress that has happened. As a matter of fact, those with benign brain tumors, 100% of these children will live more than 5 years. Now, why have these such progress become possible? The most important thing would be knowledge that has been gleaned from both scientific research as well as from pathological advances. A lot of progress with brain tumors has been at the molecular and genetic level, and molecular improvements have caused a significant improvement in the way these tumors are diagnosed as well as treated. So molecular genetics has actually changed the names of certain pediatric brain tumors in the last 10 to 15 years. So some tumors that 10 years back we would call, for example, a tumor called as PNET is no longer referred to as such. It's actually referred to based on the genes and what we call as an integrated diagnosis based upon genetic analysis. So because of such changes in the scientific and laboratory work, we are in a better position to diagnose more accurately subtypes of pediatric brain tumors which can respond to specific medicines. Now, coupled with other treatment, now surgical advances have also been tremendous. The capability of removing these brain tumors completely has significantly progressed. The reasons for this is because of better microsurgical training and skill, much improved intraoperative neuromonitoring, so that when we are near critical areas, we are capable of removing significant tumor without causing any new neurological problems to these children. The combination of advances in surgical knowledge, surgical technology and treatment has actually made significant impact on the survival of these children. So much so, a tumor called as medulloblastoma, once upon a time we almost never spoke in terms of long-term survival, whereas today it has become routine to talk in terms of long-term survival for medulloblastoma. Now, coupled with this, we have advances in radiation technology. Earlier, radiation technology was not very commonly used in children under the age of 3. It still is to be applied in a guarded situation, but having said that, the safety of radiation has improved tremendously by giving what you would call a split radiation doses or proton beam radiation. The safety profile of radiation has also improved significantly. So overall, in a center where there is a multidisciplinary and modern approach to treating these children with brain tumors, very good results and outcomes can be achieved.